Antibiotics are drugs that are used to fight infections caused by bacteria. Since their discovery, antibiotics have served as the foundation of modern medicine, and they have saved countless lives. Indeed, every day throughout the world, people are taking antibiotics to fight bacterial infections. However, a global crisis has emerged because of the overuse and misuse of antibiotics. This misuse has allowed many bacteria to become resistant to the antibiotics used to treat them. In endodontics, antibiotics are indicated in only a small number of cases to prevent vulnerable patients from getting infections during dental treatment or to treat serious dental infections. Most patients receiving endodontic treatment do not need antibiotics. They are not an effective cure for toothache and are needed only when patients develop serious and systemic infections. It is essential to tell your dentist about your general health so you can discuss the need for protective antibiotics before treatment. These are called prophylactic antibiotics. Antibiotic prophylaxis may be prescribed before some dental treatments in a few special circumstances. For example, when patients have 1. Impaired immunologic function, 2. Complex congenital heart defects, prosthetic cardiac valves, or a history of infective endocarditis, 3. Prosthetic joint replacement, 4. Exposure to high doses of X-rays during radiotherapy, 5. Taking biphosphonate medication. Your dentist will know when to prescribe prophylactic antibiotics, which you must take. The commonest way that bacteria get into teeth is through cavities caused by tooth decay. Bacteria can find their way into the center of the tooth, causing an infection of the dental pulp. If the pulp infection is not treated, the infection can spread down the root into the surrounding bone, which could cause pain, swelling, and inflammation in the bone surrounding the tooth, in a condition called an acute apical abscess. The soft tissues of the mouth and face may also become swollen. The best treatment for a dental abscess is the same as for pulp infection: root canal treatment without antibiotics. However, antibiotics may be necessary in certain cases of apical periodontitis, when the patient's immune system needs help against infection, or where a healthy patient develops a serious infection. Antibiotics are drugs that work by killing bacteria. They help the immune system fight bacterial infection. Although root canal treatment is usually sufficient to cure pulpal and periapical infections, sometimes bacteria are very aggressive. Therefore, antibiotics should only be prescribed in a few circumstances, together with root canal treatment. 1. When periapical infection has a rapid onset in less than 24 hours, causing facial swelling or an infection spreading deeply into the mouth towards the throat. 2. When there are localized swellings containing pus, and when patients have a fever greater than 38 degrees centigrade, feel unwell, and have swollen glands and/or limited mouth opening. 3. When the patient has serious underlying medical conditions, such as those with organ transplants or those whose immune defense systems are compromised. In these 3 cases, antibiotics will help the patient's immune system fight the bacteria. When the symptoms disappear, which usually happens in 2 to 3 days, antibiotics will no longer be necessary and should be stopped. If antibiotics continue to be taken beyond the time that is necessary, resistant bacteria may develop. These can cause problems for you and for other people in the future. The same thing happens if you take antibiotics unnecessarily and without a prescription from your dentist. Don't take antibiotics unless your dentist thinks you need them. Don't take antibiotics for longer than necessary. Your dentist will know when to prescribe antibiotics and which ones to use. Around the world, millions of endodontic treatments are performed every year with very high success rates, preserving natural teeth, relieving pain, and healing disease. If you have a dental problem, ask about endodontic treatment. Preserve something precious, your natural teeth.